Hi, I'm Costa Rapanos from the Just Ears Clinic. I'm going to talk to you today about some of the alternative treatments that you may have heard of for removing or loosening wax and what we at Just Ears Clinic think of those. So probably the first and commonest, most commonly used are drops. We're in favour of drops, and in fact drops can be extremely useful to help to loosen wax, and we recommend all patients who come for microsuction, which is the safest way of removing earwax, actually use drops for at least 3 days before they come to our clinic. Drops, if they're appropriately licensed, such as Otex drops or olive oil, are completely safe to use in the ear. At Just Ears Clinic, we recommend medical grade olive oil for 3 days before coming for microsuction. There are a number of other alternative therapies that are widely advertised. One that you may have heard of are Hopi candles, which are wax candles which are inserted into the ear, lit, and then with the aim of extracting the wax from the outer ear. These are, in our view and in all doctors' view, unsafe. There's no evidence that they actually do remove wax. The wax that is produced actually comes from the candle rather than from the ear itself, and they introduce a risk of actually burning the very delicate skin of the outer ear or the inner workings of the ear. So they're not to be recommended, and certainly not recommended by us. Syringing is another widely available therapy that has now been discontinued in general practices because of its unsafe nature. Although sometimes syringing can remove some wax, it introduces infection and also an element of risk of uncontrolled water being directed at the ear canal and the delicate hearing structures. So syringing again is not recommended, certainly in the UK anymore, and certainly not recommended by us. There are a variety of picks and probes that are available again to be purchased online by a variety of non-medical providers. We definitely don't recommend these. They again can be extremely dangerous to your hearing and the outer ear canal and the eardrum. I'm an ENT surgeon, and I would have my wax removed with microsuction, as would my colleagues who are ENT surgeons, because that is the safest way to remove wax.